Hello, everyone. My name is Audra, and I will be reporting on obsessive compulsive disorder today. So, OCD is a disorder that is characterized by repetitive, unwanted, intrusive thoughts that are called obsessions and irrational, excessive urges to do certain actions called compulsions. Compulsions usually involve engaging in activities or mental acts to counteract anxiety that one gets from obsessions. Typically, those two go hand in hand. So, according to the DSM 5, the criteria for OCD has to be repeated, disturbing, intrusive thoughts or impulses. You have to be unable to control or suppress the thoughts or behaviors, and you have to have relief after performing the behaviors to suppress those thoughts. Um, OCD is, according to the DSM 5, slightly more common in women, and cultural factors and racial stereotypes may influence content of obsessions and the type of compulsions. So, OCD is typically treated a variety of ways, cognitive behavioral therapy being one of them, medication being another one of those things, but the most effective is typically exposure therapy, which involves treatments that include a combination of response prevention and exposure to whatever obsessions that the individual is having at the time. This, of all options that are used to treat OCD, are typically the most effective, and they have a lower relapse rate, which means that there's a less likelihood for the individual to relapse in the past to go have those same obsessions and compulsions again in the future. African Americans with OCD are more likely to be misdiagnosed due to DSM 5 not appropriately including cultural factors in the diagnosis of the disorder. Study shows that accurate diagnoses were given to folks who already recognized their symptoms to align with OCD rather than folks who did not, which encouraged people who needed the help to not actually get the help they needed. An important factor of the success of CBT in adolescents diagnosed with obsessive compulsive disorder is support from their family to facilitate homework completion provided by therapists. Um, you need family members to be able to drive them to and from therapy sessions and be present to offer them support if they need it. They also need to play a role in exposure exercises that is provided by therapists either at the therapy place, but most likely also at home as well. And without this support, it can render CBT useless or reduce the level of like success for children who do not have these. Familial dysfunction at home can also interrupt the success of CBT for children with OCD and render those um, options less use. Yes, less. Environmental conditions are one of those things that can impact the prevalence of OCD in folks and the way the symptoms also manifest. During the COVID pandemic, obsessive and compulsive like symptoms increased in the general population, and it worsened the condition of those with contamination related obsessive compulsive um, disorder. Stigma around OCD is also mainly influenced by misconceptions and negative stereotypes surrounding this disorder that boil down to the ways that OCD manifests to one particular thing. Most people who are not educated on OCD believe that OCD mostly has to do with cleanliness rather than a variety of factors. Because of this, sharing about an OCD diagnosis with your family or your friends and just members of your community can be very difficult for folks with OCD. MHA Ohio is a local organization that provides support for folks with mental disorders and also OCD. On this page, I've listed some of the service that they provide, but I would like to highlight Goals for OCD, which is a support group for people diagnosed with OCD, where they meet on the first and third Wednesdays of the month on Zoom, and also sometimes they have in-person meetings quarterly. This is just the contact information for MHA Ohio for folks watching this presentation who need it. To conclude this presentation, I just want to make sure that everybody knows and understands that OCD is an incredibly complex disorder that shows up differently for everybody based on so many different factors, like familial structures and sociocultural factors, like where you grew up, the sort of your race, and many more things. There are resources out there to help improve your quality of life if you are somebody that feels like needs it. I hope that if you are reading this, you know to keep an open mind and be less judgmental and always be willing to learn from folks who have OCD and just anybody that's willing to share information for you with you so that you can be just a safer place for people in your community.